Avian vaccination and vaccination failure. Avian vaccination and vaccination failure. Plan for talk vaccination. Types of vaccine. Method of vaccination. Vaccination failure. Intro. Cause of vaccination failure on bird level. Cause of vaccination failure on vaccine level. Serological monitoring. Vaccination. Types of vaccine. Methods. Types of vaccines: live poultry vaccines or killed or inactivated poultry vaccines. Live poultry vaccine: live vaccine contain virus or bacteria that must infect the chicken and multiply in its body to produce immunity, preferably with minimal reaction. The virus multiplication in the chicken is necessary because only relatively small amount of virus are administered to the bird. By multiplying in the chicken, increased amount of the virus are recognized by the chicken immune system, thus an enhanced immune response result. Advantage and disadvantage of live vaccine. The advantage: easy to administer, low price, rapid onset of immunity, broad scope of protection because chicken are exposed to all stages of replicating virus. The disadvantage: problem with uniform vaccine application, excessive vaccine reaction, unwanted spread of the vaccine virus to neighboring poultry houses, extreme handling requirement needed to maintain viability of the vaccine organism. Killed poultry vaccine. A killed type poultry vaccine is prepared from bacteria or virus that have been inactivated and processed, thus will not spread from bird to bird and require individual injection. Killed vaccines are usually combined with an adjuvant such as aluminum hydroxide or mineral oil. Adjuvant enhance the immune response by increasing the stability of the vaccine in the body, which then stimulate the immune system for a longer period of time. The advantage of killed vaccine: assurance of administration of uniform dose, safety, the organism has been inactivated, development of uniform level of immunity, each bird receives the same dose, no chance for spread of vaccine organism to neighboring poultry farm, increased poultry stability and a choice for a wide variety of virus strain. Disadvantage of killed vaccine: increased cost, labor and product, slower onset of immunity, narrower spectrum of protection, presence of a localized tissue damage at site of injection due to reaction with adjuvant. Methods of vaccine application: individual application, eye drop, beak dipping, injection, wing whip. Mass application, spray or drinking with water. Methodology: prepare the vaccine suspension with appropriate dilution. Appropriate diluent: use the calibrated dropper, 1000 doses in 30 ml, 20 minutes for 1000 bird. Hold the bottle in an upside down position and apply 1 drop per bird, one onto the eye or into the nasal duct. Avoid bottle contact with mucosa of the eye nostrils. Compulsory route of vaccination for ILT and Mycoplasma gallisepticum. Simultaneous vaccination with inactivated vaccine is possible. Beak dipping: fast and easy vaccination during the first day of life. All birds can be immunized. Avoids problem with irregular water consumption. Avoid respiratory action as seen after spray vaccination. Simultaneous vaccine with inactivated vaccine is possible. Individual application: eye drop, beak dipping, injection and wing whip. The method: prepare the vaccine suspension with the distilled water. Use about 150 to 200 milli per 1000 chicks. Dip the beak of each bird up to the nostrils. Injection, very efficient, highly labor intensive, use only sterile equipment. Individual application, eye drop, beak dripping, injection and wing whip. This is one of the individual methods. Some disadvantage. This is the correct and incorrect method of injection. Methodology, intramuscular or subcut. Use sterile equipment only. Change needle every 800 bird. Dilute live vaccine in their appropriate diluent. Oil vaccine should have room temperature before application. Needle diameter 1.2 mil and 18 gauge. The length 0.7 centimeter for subcut. 1 to 1.3 centimeter for intramuscular. Subcutaneous route, inject into the lower part of the neck. Intramuscular route, inject in tangential into the breast muscle. Factor affecting water and spray vaccination. Bird immunocompetence, water consumption, maternal antibody, drinker space, ambient temperature, vaccine, virus stability in water, lateral spread of vaccine virus, immunogenicity of vaccine, vaccination timing, virus concentration in the water, the volume, time of water withdrawal, water quality, type of drinker, method of delivery, spray vaccination, the volume, particle size, relative humidity, host design, distribution of spray, uniform of droplet. The spray vaccination, rapid, good immune response, post-vaccination reaction, use distilled water only. This is mass application method, spray and drinking water. Types of spray vaccination, 2 methods of spray vaccination. Not suitable for diseased or mycoplasma positive birds. Course spray, droplet size 7 to 150 micron. Recommended during the first 3 weeks of age and for first vaccination. Fine spray, droplet size 15 to 50 micron, reserved for Newcastle's booster vaccination. Methodology, select correct spray equipment. It should be clean, free from disinfectant, used for this purpose only, well maintained and adjusted. Use distilled water for preparing the vaccine solution. Darken the animal house and turn off ventilation during vaccination and use up to 30 minutes after vaccination. Gather the birds calmly in restricted area if necessary. Walk slowly through the animal house during vaccination, about 20 minutes. Spray in direction to the head of the chicken. Distribute the vaccine evenly. Hatchery, spray 3 seconds on each box for 100 chicks. Quantity of water needed is related to number and the age of chicken, equipment to be used, ambient condition, temperature, humidity. All chicks have to be hit by the spray. Shake the head for a moment. All chicks' head have to get slightly moist. Vaccination in 2 applications might be necessary. Perform a sham vaccination in order to assess time and the volume of water needed. Mean size of the drop. Vaccination with coarse mist, vaccination with mist. This 50, more than 50 micron, less than 50 micron. Flow pressure 50 to 60 ml per minute, 2 and 3 bar. In coarse 50 ml per minute in fine mist. Volume for 1000 bird 500 to 1000 ml. In fine mist about 100 to 200 ml. Duration of spray for 1000 bird 1 to 2 minutes. When fine mist 5 minutes. Drinking water vaccine. Rapid, easy, safe, economic, no disinfectant, control water system, drink and control water quality. Methodology. Discontinue the drinking water disinfection at least 3 days before vaccination. Clean tanks, tube, and the drinker nipple only 1 day before vaccination with clean water. Don't use a soap or disinfectant. Dosing pump are not preferred, but if they are used, use a separate pump which is used for vaccination only. For preparing the water vaccine mixture, use only clean plastic bucket and tools, which must not be used for other purposes. Determine the volume of water needed for 2-hour uptake. The volume of water varies and is mainly influenced by number of chicken breeds, age, temperature, and feed. Carry out a test vaccination 1 day before without vaccine, but with skimmed milk powder in order to ascertain the adequate time of water deprivation, 1 to 2 hours. Assess the water consumption during 2 hours. Skimmed milk powder bind residual disinfectant in the tube system, deed volume, and minerals. Preparing the drinker system for vaccination before and during water deprivation, preferably in the morning. Ensure a sufficient amount of drinker or nibble. Cut off the water supply, immediately, and drain off completely the whole drinker system. Be aware of the deed volume. Preparing the drinker system for vaccination before and during water deprivation, preferably in the morning. Ensure a sufficient amount of drinker or nibbles. Cut off the water supply, immediately, and drain off completely the whole drinker system. Be aware of deed volumes. Preparing the water vaccine mixture, use correct number of vaccine dose, never underdose. Prepare the water vaccine mixture on a clean disk in a clean room, using a clean plastic bucket and tools. Use only clean water of very good quality, mineral water, for dissolving the vaccine. Small volume. Add 0.25% gram per ml skimmed milk powder to the required volume of clean water of good quality. pH 6, no bacteria, no chlorine, no metallic ion, no disinfectant, and mix well. Maybe replace skimmed milk with air stabilizer recommended from the company of the vaccine. Mix well vaccine solution with a milky water by means of a plastic stir. Perform drinking water vaccine after water deprivation. Fill and drain the whole drinker system with a milky water vaccine mixture. Make sure that milky water vaccine mixture or dye arrive at each drinker nipple and the end of tubes. Make sure that all birds drink the water vaccine solution by going slowly through the chicken house. After complete consumption of the water vaccine mixture in about 2 hours, refill the drinker system with clean water of good quality as its maximum, and add skimmed milk powder. Here the water system. Here a pill drinker, 1 for 80 or 100 bird. Here the nipple drinker, 1 to 5, 10 to 15 bird. Here the cup drinker, 1 to 25 or to 30 birds. Troughs for the feed. Drinking water quality according to EU norms. The pH 6.5 to 8.5, maximum 9.5. Organic matter less than 5 mg per liter. Nitrate less than 50 mg. Nitrite less than 0.1 mg per liter. Ammonium less than 0.5 mg per liter. Chlorine less than 200 mg per liter. Iron less than 0.2 mg per liter. Total germ less than 10 colonies per 1 ml. Total fecal chloroform less than 5 per 100 ml. fecal streptococci less than 5 per 100 ml, Clostridium species less than 10 per 100 liter. Challenges: drinking water vaccination challenge, the problem and the effect and the corrective measure. Problem: excessive time for vaccine solution to reach all birds. The effect: vaccine titer may drop below immunization level. Correction: drain residual water and fill water system with vaccine under pressure with dye. Excessive residual water in line, delayed delivery of vaccine to bird at the end of the water line. Fill water, the correction: fill water system with vaccine using dye while simultaneous drainage residual water. Vaccine solution consumed in less than 1 hour. Vaccine consumed by dominant bird only. Too many vaccinated remain uneven application of the vaccine. Increase volume of vaccine stock solution. Decrease water withdrawal. Correct volume of vaccine solution consumed in more than 2 hours. Vaccine titer may drop below immunizing level. This is the effect. The correction: split vaccine into 2 successive vaccination, 50% plus 50%. Airlock, delay delivery of the vaccine to area tire in the house. Fill water line with vaccine with dye while draining residual water. This is the effect. Also the effect: uneven vaccination of the flock. Fill water line with vaccine before light come in the morning. Birds at back of the battery last stage do not receive vaccine. Vaccine volume not enough to fill water system. Uneven vaccination of the cage now. Increase volume of vaccine solution. Drain residual water. Turn off light while filling water line with vaccine.